this morning. Can I ask how much of what we heard in the first session, because I know you were probably listening, were you aware of in terms of the hold-up on electronic healthcare records?
I wasn't aware on the specifics of the... I mean, we're obviously aware that things have not progressed, but no, I wasn't personally aware of the specifics of why. And to best of my knowledge, most of our member charities are not aware either. And that in itself is an issue. You know, we need to be part of the conversations.
Were you aware that there's no current and updated business case for that issue?
No, I was not.
Were you aware that the business case is linked to the Children's Hospital?
No.
Okay. All right, thank you. I think that's really important, because when you look through the parliamentary questions, any of us who are asking about the electronic records, we instantly get an answer which mentions the Children's Hospital and mentions the newborn programmes, but doesn't explicitly say that the rollout across the whole health system is based on the performance of those things. Do you have a concern around that?
I have a big concern. I mean, obviously there's back and forth, and we want to make sure we do this properly, because the worst thing actually would be to do it in a way that causes more harm than good. So I do understand the need for lots of discussion and consideration of different models, consideration of international practice, the plans the EU have. But I'm very concerned about the timeframes and how long that has just been sitting there without progress, that original business plan wasn't reworked in some way, revisited, that there was no discussions at a national level about the hold-ups.
Considering what we've heard this morning, and I know you're not experts in this particular area, I know it's more around the data, what would you expect to see in terms of like this being up and running in Ireland? I mean, we are not even at business case stage. We are years away from a working electronic healthcare system. Is that correct? Years away.
It would seem to be.
Okay. As I said to our previous witnesses, I actually had questions around like the operation of data collection, particularly for research, and obviously selfishly for our own purposes. It comes up every week around evidence-based design and having that data. I did want to touch on a couple of areas in relation to if the business case was happening and if we were at that point. I think that there's an assumption, certainly when we talk to the HSE around this, which is it's very much around just the tech system. But I wanted to touch on the staffing and training aspect and the load that will place on the HSE. So I'm aware, for example, that sometimes, you know, you'll have outpatient clinics where you have a specialist or a nurse practitioner or somebody who then has no admin support. If we're going to do electronic data correctly, we have to input the data to begin with. So I was wondering, can you outline what you think the load will be for across the health system in terms of, will we need additional admin staff or people who are particularly assigned to, whether it be clinics or departments or whatever, who are tasked with data collection in a particular way? And will there be a requirement to roll out training across the board for all frontline staff? I know I read a very interesting paper around ethnic research and training people to ask the right question in a way that they were comfortable with and that didn't offend the person who was being asked the question. So I'm wondering, could you talk a little bit about that, about how we, you know, what the load might be in terms of staffing, that we may need to see an increase in staffing specifically for correct data collection?
Yeah, I'll speak to that for a moment, and then I might pass to you, Mark. But I do, from work that I am very familiar with in patient registries, there is generally some short-term pain for long-term gain. And we have to be really mindful of our health service staff. They are already under far too much pressure. And so it will need to be resourced. That side of it will need to be resourced as well. I mean, we heard at this morning's session that actually, in the longer term, health service staff will really value the things going digital, and it's going to make their life easier in the long run. And I think another part we have to think, that's not exactly what you're asking, but that's what we have to think about, is the conversations with patients early on as well, very early on, in terms of their consent to the whole process, in particularly coming from our perspective, capturing their consent around research very early on. But I'll hand over to you, Mark, to say a bit more on that.
Yeah, and Deputy, just for the record, I was aware of some of the issues because of my position in the Health Service Executive before leaving the Health Service Executive to work in academia. I worked on the Programme for Health Service Improvement.
That doesn't count. That's not official knowledge.
Okay. So unofficially, just for the record,
Okay.
I was aware of many of the issues, particularly around the
I suppose
business
really
case.
what I was asking is, had the HSE communicated officially particularly, section 38s and 39s? And, yeah, okay.
But to answer your question, there will be a load, of course there will be a load as we transition. The big question is, for the system is, should we have started this 8-9 years ago when we suggested we should have, so that the load would have been less, the cost would have been less? That's the bigger questions to be asking. This has changed. Most of the health service and public services in Ireland have had various pay claims based on change and transformation. So I think the platform is set. The amount of public servants that absolutely embraced technology and digitalisation during the pandemic and pivoted very, very quickly shows that they can a demonstration that this can be done. But this goes back to the original question about the end user. It's very, very difficult for me to explain to my elderly father how he can insure his car, book his NCT, go and see my brother in Spain on his phone, but he has to ring and sit for 25 minutes on the phone trying to book an appointment in the outpatients department. So the end user is absolutely key, and that is the catalyst for change for the health service and all health service personnel.
I want to return a little bit to the patient interaction with this and understand a little bit about your interaction with the Data Commissioner and whether there has been any information or interaction with the Data Commissioner or their office on, I suppose, both generally research and particularly genomics, but also on that health information bill, or is that anything that you're aware of?
We have had contact with them in relation to the health research regulations in the past, but not on the topic we're discussing today.
Okay. Do you expect to, as this becomes more, more rolled out, hopefully?
I think it's important that we have discussions with any of the players that are going to be making decisions around this. So yes, and we would really welcome that. I think we're not just here to complain. We can also offer some solutions because through our member organisations, we represent a huge amount of the population, and our member organisations are very, very informed, very engaged in these topics and want to see progress. So what we'd like to see, because we keep hearing about these barriers, and it's really hard to understand what exactly are those barriers and who are they coming from. So I think a thing that we have to remember is if we involve patients themselves in these conversations, it becomes very hard to defend positions that are not in the patient's best interest. Mm-hmm. If they're in the room, I've seen it so many times where a patient is in the room, it changes the whole conversation. And that's the kind of thing that we'd like to see. And that's also the kind of thing that we can help with. So yes, we would like to have conversations with any of the stakeholders involved in this.
So just a more transparent process is what you're suggesting. It sounds kind of like a forum or something. Can we just return very quickly before my time runs out to your description of the health data space, in the EU or in Europe more generally? And I suppose I'm particularly thinking of it in terms of genetics, obviously, because there are so many other countries who are doing better in that regard, particularly interested in that area. And we've talked a lot this morning about sharing information between institutions, how we do that safely, and how we do that kind of comprehensively. Are we starting to see a space in Europe where countries are sharing specific data in real time, in longer term in terms of research? How would we go about facilitating that? And do we believe we need different legislation, extra legislation to make that happen?
I might ask my colleagues to think about the legislation perspective, but yes, what we're seeing is that Europe is now, as of last year, discussing a health data space across all the member states, which is very exciting and very, very ambitious. And it's going to help with things like cross-border healthcare. For example, if you as a patient are on holidays and you need to fulfill your prescription, then you will be able to use a number that is unique to you to get your prescription in Spain or France or wherever it is. And it also is very mindful of research from the very start. So just as you mentioned, Deputy, it's about enabling that research across borders as well, because we need to think about that from the start. So I suppose the challenge is, in order for Ireland to be really part of that, we have to have our own house in order.
But they also have to align with EU systems.
Yes.
Okay.
Yes.
So it's not just that we can't just develop it domestically. It has to be able to talk to those systems, not between hospitals, but also between cities and in other countries.
And my best guess is that more legislation, possibly something like GDPR, will be guided by Europe, but I don't know the details of that.
Okay.
I don't know if you know more, Mark.
Yeah, no, and I can't think of anything that is currently precluding us from engaging in any of the European programmes when it comes to gathering data, getting data. Where sometimes
Other than that, we don't do it.
Yeah, that's the problem.
Okay.
Is sometimes we're behind our partners on many of the projects because of the timelines. Like, to get an ethics approval in Ireland for any of and some of our members are involved in clinical trials across Europe. We fall way behind our partners, embarrassingly so, at many of the European meetings. That's the first thing. The only thing I can see which has raised its head here in Ireland is export control. The types of data that we're creating and how we control that and share that across the world is being raised by not the Department of Health, by the Department of Trade. Because we create and generate an awful lot of knowledge and an awful lot of commercially sensitive and security sensitive information, even around genomics. Which you wouldn't think would create an issue. And the research community in Ireland are really grappling with that at the moment. We haven't had any shackles put on us before. We've had very liberal approaches to what we do with our data, what we do with our commercially sensitive information, and how we share that with our partners in Europe. There's a whole new spotlight come on that, Deputy, in the last 6 months, and it will continue for the next 18 months while we navigate our way through that. But I don't see anything precluding in Irish legislation us stepping up to the plate in Europe and playing our part.
Okay, thank you.
Just if I briefly, Deputy, there are good examples, again, going back to the registry space, where Irish registries are feeding into European registries. Cystic fibrosis would be an example, but the systems are aligned, and you know, it's a lot of work has been done in that area to make that happen.
Okay, thank you.